Hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Lawrence Doan, and today we're joined by Dr. Alexs Khominsky. Graduated Dux and Moore Medallion at the University of Adelaide with the first class Bachelor of Science in Dentistry Research Honours, completed his primaries with distinction. He worked as a new grad at the Alfred Hospital doing general dentistry on medically compromised patients. He's also worked in private southeast Melbourne for another 2 years before starting perio postgrad at Melbourne. He's a massive believer in the recent graduate CPD journey, so much so co-founded General Dental Residency to create a 12-month program for early career dentists to improve the foundations of general practice. Dr. Alexs Khominsky, welcome to the show.
Thanks, Lawrence. Thanks for having me. Hopefully this will be kind of an interesting talk and hopefully enlightening to people and get something out of it.
I'm sure it will. So tell us about your CPD journey so far.
I think for me, it's been, everyone has, I think, a unique and different journey. And I think I have always been of the mindset of trying to figure out who I am. And so probably close, in my fifth year back in uni, well, I don't know if whoever's listening, we studied together. I probably knew that I was interested in perio and I was interested in specializing. And so that in many ways, for good and bad, and we can talk about that, framed my perspective of my CPD journey. And so I think I figured out, and I have a lot of respect and a lot of admiration for a lot of general dentists out there who, are exploring different parts of the CPD journey, really going into comprehensive education, like yourself with King's College, going through orthodontic diplomas, implant diplomas, and really culminating in a really broad set of skills that, really helps and benefits patients. For me, I think I realized that, maybe in some ways I wanted the easier path. I wanted just to pick one area and really become really, really proficient and really excellent and, further that field. So my CPD journey kind of started with that in mind. But, one of the things I think I realized and was really challenged with was figuring out, well, if you specialize, you lose out on a lot of other things. For me in particular, I always, although perio is, has a lot of benefits, prosthodontics is really, what patients see. And, having that feedback from the patient and kind of delivering that service where you can get that aspect of things is really beneficial. And, talking to a lot of periodontists and prosthodontists and surgeons and general dentists, I think I realized that, although let's say, my enjoyment was always, let's say, in perio or surgery or whatever it may be, but I think for me, the focus was actually to try and do the exact opposite. So kind of going out of uni, had my experience at the Alfred Hospital, which we can talk about as well. But my focus was try and do things that really expanded and broadened my horizons as much as I could before I really started to focus on applications for specializing. So I attended a lot of, day, weekend courses on prosthodontics and planning. There was a lot of kind of behind the scenes orthodontics that I was trying to learn. Hopeless at it, but I tried. And you kind of mentioned prior before that, Botox and looking at injectables and trying to understand that. Endodontics, I did endo courses as well. So for me, it was really focusing on trying to expand my level of knowledge in a broad set of general dental and kind of figure out, okay, well, what are going to be my weaknesses? And even, let's say, whenever I got into specialty, and try and build those up as much as possible. And even now, I'm doing periodontics, but, I've had opportunities to observe the prosthodontist in the post-pros department because, just to see how they work, how they think, understand that level of treatment planning, I think just makes, everyone a better dentist or specialist overall.
Yeah. Okay. So I'm gonna rehash. We're gonna hash back right to the beginning for a little bit. Yes, for some of our viewers that don't know me and Alex, we went to the same uni, same year as well. So I find it very interesting talking to other friends as well that have graduated who are from different unis. But AUDSS is the Adelaide student body group, and you were actually the ex-president at the time, right? And one of the things that you did that was pretty good was you pursued workshops, you got interstate speakers, you got mentorship programs, all these things kind of getting started. And I want to say, compared to what I was seeing with all my other colleagues, they weren't getting that. I think and I want to say this, before we get further into interview as well, I want to say a special thank you to you, Alex, and your AUDSS community, because for allowing me to share a piece of what we were doing as students in Adelaide and what ultimately led to what we were doing, like the national ADSA talks being created at the time, courtesy with Omar Ikram, presented the first interview as well. Looking back, that was completely different to what all the other students were doing, and you're kind of continuing that on to now. So you're saying that when you were graduating, you were kind of still trying to dabble in a whole bunch of different things. So was there a particular one that you found that caught your attention, or how did you come across these particular courses that you were selecting to pick?
Actually, it's really nice that you remind of that time. I think that really reflects, I think, just me, my general persona of curiosity, and there's a limitation of how much obviously you can intake, but you mentioned Omar Ikram, we had Peter Sheridan for photography. We had Lincoln Harris as well before. Obviously he blew up even more than he was at that point. And you have so many these groups of people of with different wealths of knowledge. What the reality is, I think I found it very hard to pick courses. It's awesome that CPD Junkie has this directory where you can actually compare, reflect, and have a comparison of different programs, because a lot of the time things are based on word of mouth, convenience. Is the travel there? Is the travel not there? Time off work. For me, one of my challenges in my first year was working in a hospital was really full on. It was full time, and the 4 weeks that I had off, 2 were for primary orientation course, and then 2 weeks were for the exam. And between the exams, I was working as well. I had a couple of days that I had to work in between. So I didn't get to explore as much of my CPD journey in that first year. I started to work a little bit of private, but in my second and third year, because I think the other aspect of CPD journey, and this is something I think I've also come to appreciate, is you can do whatever course you want, but if you can't implement it the next day or the next week with patients, the amount you're going to take from that course is always going to be limited. So obviously working in a hospital environment, you have such limitations. And to be honest, I'm very fortunate. I had, specialists like Matthew Lim and Tammy Yap, oral medicine, and a special needs dentist who taught me, so much, and I got exposed to so much that honestly couldn't be taught in courses. I was seeing patients seen by oral medicine specialists. So, I was helping out with sleep apnea appliances, TMD, oral facial pain, mucosal lesions, biopsies. There was a general dentist there who's also part of the college who was seeing a lot of patients and doing a lot of removable prostheses. And these are patients who had oral antrofistulas and maxillectomies and, major resection, things that you honestly, I say, read in a textbook and you think, okay, you get quoted, you'll know, Prof. Goss, you'll see that once in your lifetime. And that was my first year. And so that was really cool. But, a lot of CPD courses are really not tailored towards hospital experience. So I waited till my second and kind of third year. And, I had really fortunate bosses. There's Dr. Slav down in Cheltenham and Dr. Tiv, who some of your viewers may be aware of, Dana Balnaring, who I think taught me a lot in terms of pragmaticism, how practices run, the importance of patient care and that whole kind of nature of relationships. So the CPD journey has to fit into that. So yeah, it's a bit of a challenge, and I think it depends on the clinical environment that you're in. Is there a specific question I can maybe answer better for that?
So I guess, okay, so I'm just going to rehash it for some of our listeners. So basically, you were in the Alfred Hospital and you're consuming a lot. There is so much content you're consuming. You're probably going back home and you're probably doing more research on it to follow up on it. And so there wasn't really particular CPD courses at the time that would complement what you were doing, or it was going to build on it more at the time because you were already doing so much of it already. And then it wasn't until you came out to private that, okay, well, you realize now you need you need other skills to kind of complement your work that you find in private practice. And that's really when, you decided to go and attend particular courses. But when you're at the hospital, you were learning a lot. It sounds like, and
you have patients who just had chemotherapy, radiotherapy. They're on these medications that, you think came out of a leprechaun at the end of a rainbow. And, you look up at research and there's there's like 3 medical trials in the world on this for whatever reason. And there's so much that you don't know, and, trauma, and part of the thing that really I got a lot of beauty in that was being able to see dentistry from a different perspective and seeing how it interplays with other medical specialties and things like that. But we can talk about my private journey a little bit.
Yeah. Well, just on that hospital aspect. So, you just mentioned that that connection with the other medical professions. You actually went on to create a little Instagram page called Your Wellness Dentist, wasn't it?
Yeah, there was a time, I think, I was really inspired. And, one of the reasons for my interest in perio, and it's not that I chose perio, it's I had interests and those interests aligned the most with perio. And for your viewers who haven't read the book Malcolm Gladwell's Starting with Why, I think it's one of the best books I ever read. And not that it changed how I worked or studied or whatever it may be, but it cements and really makes you try and nail down understanding why you're doing what you're doing, because that just gives you so much purpose and confidence in the decisions that you make and making decisions you don't regret. So seeing, and with the Instagram, for example, I see a lot of social media and people posting amazing cases. You have everyone can name a lot of the speakers that you had prior to me post awesome stuff, and there was a little bit of that, but that wasn't me. And so I was just trying to figure out at that point, how does social media and what am I actually interested in, and what do I want to share? And so there was a period I've archived a few things just because I kind of that trailed off just because life got busy and other priorities. But there was a period, I think, once a week I was posting, what's a fact that relates oral health to systemic health. And that's still something I really, really do believe in. And, trying to figure out a way, okay, how can I kind of share more of that? But, do more of that as well.
But you also, at the time, you actually created some articles, some case reports or systematic reviews on, was it spontaneous bronze? So I had a research honors back in Adelaide looking at, craniofacial syndromes. But in the Alfred, we saw a lot of osteonecrosis, and, one of the things that we saw a lot of was just patients who didn't have the classical bisphosphonates or anti-resorptive therapies. I should also say extractions of any kind. And, why are they developing this osteonecrosis? Because most of the literature that looks at osteonecrosis doesn't really take into account, well, did a procedure, precipitate that osteonecrotic event? So obviously someone who's on a lot of bisphosphonates or anti-resorptives and they're a high-risk patient and you're extracting a tooth, let's say a lower molar, obviously the chances of them developing MRONJ is actually more significant than it appears in the papers. A lot of the literature out there, whereas a lot of the literature assumes that perhaps patients are just getting this osteonecrosis. So we just kind of coined the term spontaneous, but there's likely some sort of oral trauma that's going on in areas where there's thin tissue, especially most commonly the lower
border of the mandible on the lingual side, or tori. But yeah, I mean, that was, look, I enjoy research, and there's a lot of things I enjoy. I think that's part of the challenge of trying to find a balance, and, what are your priorities? And with, general dental residency and my focus, making sure the residents that we have at the moment having a great time and trying to create more and new programs. Those kind of interests have, I wouldn't say change, but it's just the time, I'm sure you understand. And there's a lot of people out there that you got to pick what's important to you right now and focus on that.
Yeah, okay. So now you've come out of, into the private world, and you're starting this journey in private practice. How do you decide to pick? You mentioned, you're hearing about communication, you're hearing about ortho, you're hearing about implants, endo, how are you picking amongst all these different ones?
You know what? I think I was very fortunate to have Tiv as my mentor in that speed. Tiv's done so many communication courses, and he runs, communication courses for us now with GDR. And, he taught me a lot of kind of the fundamentals of just understanding patient psychology, understanding how to communicate better. 50% of what we do is communication. So being able to make sure that patient experience is not just a feeling. We spend so much art and science on, make sure restorative protocols, endodontic protocols are all, perfect. But, communication is not different, and you have to create your own. So for me, I was fortunate. I think I had one of those raffles that you think you'll never win. I think BOQ Specialist, kudos to them for sponsoring. I think we're giving away a Prime Speak course. So I did that was kind of one of the first courses that I think I did. I learned a lot in the practice. I remember coming out of Alfred, and my crown preps were shit. I was on for Sarco models, re-prepping and redesigning and trying to figure out, again, just relearning and practicing. And, I think it's important not to have pride get in the way of things, and just make sure that you're doing things well, before you're doing them with patients. So that was that aspect of things. And then, there's just been kind of opportunities that have come along with, different speakers. Kind of, you see a day or 2 days and there's a good talk. There's others out there who are organizing kind of small events, and you do an endo course and you do a pros and crown course for implant restorative, I think it was Chris Hart at the time.
But was there a particular kind of like structure or process you're kind of, or was it kind of more like you opened up the book and you're looking through what was in the year, and then you were deciding, okay, this is what I want to improve on?
Yeah, I mean, that's literally, I open up the ADA book, and I would try and circle one or two things. And then if things came up, again, you just circle and you kind of think, and that's, and that was the challenge, because I'm not sure what your experience was, but you're thinking, okay, I want to become a better general dentist. And the question is, okay, how do I do that? And you're not like, I just want to do implants, or I just want to do ortho, or whatever those fields are. How do you do that? Well, I'll be honest, there wasn't really a good way of doing that. And, that's what inspired us, to create the residency. That's literally the whole purpose of the course is, which is, 12-month course, has 7 weekends, 14 days of hands-on, covering pros, endo, communication, treatment planning, restorative, anterior, posterior, implant, all the rest of it, and mentoring, was to answer that simple question of, okay, what is something out there that will cover the bases that I want to cover, and also, with, I think something to be conscious of, and something I've struggled with is at one point, is to specialize. It's a very costly, endeavor, financially and time-wise, and it does give you kind of a lot of restrictions. A lot of us pick dentistry because it offers us a freedom that other professions may not have, and so we're kind of restricting that freedom. And maybe it's like 3 steps backwards for a 5-step forward type thing at some point. So I was conscious and cognizant of that potential investment. So I also didn't want to take on and do courses that, would cost, $20,000-$30,000 plus. And to be honest, I probably wasn't ready for them either, because some of those courses you need to understand basic and foundational principles to really make the most of them. Not that you can't do them, but yeah, that's kind of where it comes from.
So how did you approach after, tell us how creating the GDR, how's that shaped your approach to how you see graduates should approach their CPD learning?
You know what, like GDR was the most, you talk about courses. I've lost track of how many, webinars or courses or workshops I've started to have to do, just because, and I'm sure for you, your sake, so for someone who is interested and, you have yourself with CPD Junkie, and, there's a lot of other really great providers who are offering free education. I think the first advice is lap that up and, learn everything that comes from these kind of really digestible, easy forms, so that you can kind of make your own opinion on what's a good program and what's a program that fits you. My advice to new graduates is focus on getting a good job and have a practice that allows you to do the things that you want to do. So if you are like a super gung-ho about surgery and you're going into a practice where there's no one that does surgery, you can say goodbye to your surgery dreams, because unless you move, it's very hard to develop that ability to bring something in, because we all need mentors, and we all need that supervision and support and having that confidence that someone can help us develop that hand skill. That's just the reality of what we do. So that's number one. And if you're not sure of what you want or what practice, well, then just make sure that practice covers the fundamentals, the foundations, that they do enough of everything on a regular basis, or go part-time and, do part-time, because no single practice could be perfect. Everyone's going to have their, one practice might be great with just high-end work. Another practice may develop your surgical skills because you're seeing a lot of extractions. And the other thing is, don't focus on the financial side of things. Just focus on developing a skill. We're in a fortunate industry where we all, who work hard and, will make a good living. So yeah, focus on that practical side of things. And then, after 3-6 months, once you've kind of settled into that groove of things, then really start to try and, my recommendation is going to be to do foundational courses and really make sure your restorative skills are on point. Make sure that your, quadrant dentistry and prosthodontic skills, and, these days with scanners and CAD/CAM, if your practice has that element of things, learn that. Make sure your endodontics is really good. Like whether you like endo or not like endo, I feel like, everyone loves endo at some point, then you do enough of it and then you don't like it. But, I don't know what you're feeling. That's the feeling I had. I thought I had an amazing mentor at uni. I don't know if you remember Ian Tranter. So don't think he's listening, but if you are, kudos. He was just a legend and really gave me confidence to do a lot of more endo. But you start doing it, it's really like, it's like any area of dentistry. It's really hard when you start doing more and more and you see kind of different levels of complexity. So yeah, that's kind of my take on it. Give yourself a few years, and then once you've got those few years, obviously if you're keen on specializing, make sure you create opportunities for yourself early on. I think that's really important, because things take time to develop and process. I started perio this year. In fourth year, we had a 2-week holiday. I went and followed, so that was fourth year, 2016, 5 years ago. I went and shadowed the perio department for 2 weeks straight. I was here from 8 to 7 p.m. for 2 weeks on our holidays. And, it took 5 years for me to get to this place now, but, sometimes that's just what it takes. So just understand, things will come, and not to rush things, and enjoy the process. Like life is, despite all these, lockdowns, we're in Melbourne, we know it, you're in Sydney, you guys are starting to realize how shit it is. So yeah, it's making the most of it.
Yeah, I think you put on you're on the point there. I think for many graduates, at our stage or at your stage as well, they contemplate about that specializing, or that practice ownership. They're in that dilemma, and what you talked about going to visit, the specialists or in their departments, and to kind of view and kind of connect and talk to them about it. That's interesting because you actually wrote a piece on, what I wish I knew. Was it trying to find out your own career path for like the Melbourne High Old Boys Association, wasn't it? You wrote a piece on that. And I think in that you're talking about, this is what you got to do. You got to go. You got to choose it based on your lifestyle. You got to find those jobs, interact with these people with real world experience, talk to them about the highs and the lows, the struggles as well. And that's exactly what you did. And it sounds like, that's what made you decide to specialize in perio.
Yeah. I mean, you know what, this really reminds, have you seen the show Hot Ones on YouTube?
Yes.
Anyone out there who's listening, you're doing great. You've really done your research, so I'm so impressed. But yeah, look, I think it's really important to understand. I think we all have the concept of grass is always green on the other side, and we think, if I do that, all my woes will be solved. But life just is not like that. So yeah, I remember, speaking to different specialists. Shadowing different specialists, talking to MaxVax. For a lot of those interested in periodontics, there's a lot of crossover with MaxVax. You got that medical side of things, you got that surgical side of things, and I spoke to surgeons and had questions about the freedom, the opportunities, what restrictions you have, ability to have a family, and in some ways, it's a lot easier, obviously, for me as a male, but there's a lot of challenges and a lot of life factors that are, much more important than just what we do in clinic. So, those things have to fit. And, talking to them and asking them, kind of what their experiences are, and asking, okay, well, is this element of your life that may be important to you? So for me, family is really, really big. Are there limitations on that? And if there are, and you got to weigh up on a scale of what's important to you.
Like the timeline, how does this specializing for the next 3 years, you're just going to block it out. How does that fit in your timeline in terms of family, other commitments? I hear what you're saying. Yeah. And, whether the question is, do you start now or later? Yeah.
All of that. And it's, it's not just you, it's your partner and, whatever other, people you're looking after or caring for. Yeah, it's a more complex thing, especially with specializing. And that's one of the challenges, because I think, for me, picking dentistry was one of the main draws to dentistry. Was I thought I might be interested in practice ownership. I really had no real family in business or anything, so I wasn't 100% sure, but I thought maybe I'll be curious. I was always interested in teaching, research, but having the flexibility, because that's something that we are very fortunate to have, because it really allows you to explore, whether it be more dental knowledge or have other hobbies or interests that not devalue our clinical or dental things, but actually make those much more enjoyable. Because if you have one job and you're doing 6 days a week, if you're in the same place seeing the same people, even if it's an amazing place, there are certain challenges and imperfections that will creep up and create erosions of some nature, unless there's a way that you keep that diversified and interesting and all the rest of it. So for me, having that flexibility to maybe, let's say, do clinical 3-4 days a week, but then have other interests, was always a really big draw.
Yeah. So I'm going to rehash it back a little bit as well. For some of our viewers, they're probably wondering, I'm newly graduated, I'm thinking about it, but how do I get connected with these people? Do I just talk to my local specialist, or do I go join the local study clubs? How did you go about, finding these pathways to get into these departments, to kind of talk and find these connections?
And that's a really good question. I firstly, I think the main element you need to give yourself is time and persistence. Like the thing that draws and attracts people is someone who is passionate, but passion can be fleeting. You can have an interest in something and then be gone the next day. So if you can, and this is just something you have to ask yourself and show in your actions. But if you can show, you're going to be there day in, day out. You're going to be, if the opportunity that you have is not maybe the opportunity that you want, I'm not sure what it may be. We can use an example, like you want to, get into endo and you applied and you didn't get in. Well, have you given yourself enough time to get onto that program? Have you, and if that's the case, then don't feel bad about it, but take a step back. Okay, which endodontist can I chat to? Who's involved with the school? Everything is about relationships. And when people see that someone's interested, someone is dedicated, like the example I had is I spent 2 weeks on my holidays, following postgrads. I got nothing out of it other than just being tied back into our semesters. And some people go for a day, some people go for 2 days. It's you have a completely different level of a relationship with the heads of that department or whoever it may be by being there for 2 weeks. And how those relationships come about. Well, for us, we had a periodontist, Dr. Suju Kaur. It was a matter of asking her, trying to have her make that request on my behalf. And again, me trying to develop that relationship with her. And then same for people looking for jobs. That's a really hard one, especially I think for recent graduates and new graduates. There's lots of amazing jobs out there, but there's also a lot of very difficult jobs. And then finding also an amazing job that's in the right area.
You're asking for the lottery, winning the lottery.
Yeah, especially especially if you look, if your dream area is metropolitan Melbourne or Sydney, for example, where majority of Australia is just statistically, you're asking for a lot. And so being persistent, making sure that you show the people who you inspire to, if you're seeing someone who's like pumping out work that you just love, just asking them, ask what you can give to them. Can I shadow? Can I take photos for you? Like whatever it is. And you'll find that the good people are probably going to be more than happy for you to be there and help them out. And then they're going to develop that relationship with you and then help you out on your journey. Whether that be in specializing or whether it be finding the right job and having that recommendation. It's just where it is.
Yeah, you got to put yourself out there basically. And I like the fact that what you mentioned and some of our other presenters talked about as well, other guests talked about, was that people don't realize, but your connection at uni is actually one point of contact that you can go to go elsewhere, because Australia's a small world. And just like you've said, you just talked to Dr. Kaur back in Adelaide, and she kind of liaised you with someone back in Melbourne, and that's how you kind of join the dots. But yeah, you got to have the right attitude, the persistence to demonstrate that. Otherwise, you might not go the distance. So, for some of our viewers, for some of your followers in particular, who are keen, you're pretty keen on displaying that composite veneers, the full mouth rehabilitations. For them, they would have thought it was quite strange that you were choosing to pick specializing in perio. But as you've mentioned already, that was something that you were already doing behind the scenes, but it was more these cases that was what people were looking for. Is that what you were saying?
In terms of like the posts I have on, let's say, the study club, is that what you're referring
to? Yeah, because for a lot of your followers, I don't have a lot of
firstly, I think perio is a hard one to take photos of and, have, immediate photos and immediate, recalls and things like that. So that probably it was a big factor in it. But I think, again, it just because, my area, let's say, of specialization right now is perio. Perio is really a supportive specialty. perio is what gets, the foundations right for ortho to work. For, essentially, if someone wants to keep a tooth in or, replace it with an implant, essentially periodontics has some involvement in that. 50% of adults have some sort of periodontal disease, from mild to severe. So, most of the adults that you're seeing have a predisposition to periimplantitis or other factors that it may be. So where that comes into is a lot of the planning from a periodontal standpoint really is important to understand. Well, you may have an orthodontist requesting your assistance. You may have, a tooth post-orthodontics that has a recession defect and needs some coverage. Understanding orthodontics and understanding, okay, can I have torsional or changes, or can I, actually position that root in a better position to make my connective tissue graft better and make that result better for the patient. Prosthodontics obviously lends itself to, anyone doing full mouth rehabs. Is their periodontal disease stable if they have it, and then, B, dealing with complex implants. So the reason I was posting the cases I was posting is because actually, genuinely, I just found that's what I was doing more of, because clearly, I'm not at the level where I was doing, a lot of soft tissue grafting or a lot of implants or anything like that. And I just wanted to kind of show that journey of me learning and getting better. And really that's, I haven't been great on Instagram, but like the Study Club has really been my outlet of just showing things, trying to explain things, showing when things aren't perfect, and, just being conscious of those, that situation, understanding, okay, can I improve it? Or, I saw it and therefore I did improve it. That's where that came from. And yeah, that's kind of just where that is now. And with a periodontal kind of treatment standpoint, with time, you're going to see probably most of my photos are just going to be for, perio patients in one form or another.
So what you're saying is basically you had always had an interest in perio, and then you weren't quite sure, but it was that you were making these connections with people, you were talking to them, and that was really kind of what drew you to be a bit more interested in perio. Decide that you want to do it, and you made the realization when you were doing all these particular cases, you realized that at the end of the day, it was the foundations of what these teeth were built around. That's really what was important, and that's what you felt was really important, and that's why you wanted to specialize in perio.
I'll just quickly touch on that. So for me, perio came down to, understanding who I am and what my interests are. And so it came down to, I briefly mentioned, my interest in specializing and being that kind of focus field. Second aspect was I've always had an interest in systemic health, and amongst the specialties, perio has by far the most literature and research and basis on that interplay between periodontal disease and systemic health. My research project, COVID permitting, is going to be looking at the relationship between stress, anxiety, depression, periodontal disease, the subgingival microbiome. So actually looking, okay, what bacteria are associated with higher mental health and stress outcomes, or anxiety and depression outcomes. And then a secondary outcome we're looking at is metabolomics. So metabolomics is essentially looking at what are cell products that your body is creating. We're looking in the mouth. It's kind of a more new age because it has possible connections for diagnostic testing where you can do a simple cheek swab and see, does someone have a predisposition for perio or predisposition for stress, anxiety, or there's a lot of literature out there looking at cancers in particular. And so you're assessing for these little cellular byproducts that your body or bacteria produce. So, that has never changed. And that's, why my research honors was on craniofacial development. I would have done a different project maybe if I had other options, but that was the one that linked the most with systemic health for me. That's why I did the Alfred job. I don't recommend, the Alfred Hospital for everyone, or for people who have particular goals in terms of what they want to achieve in private general practice, because I don't think it will align and give certain people benefit, whereas might give others. So that was 2. 3, I always loved teaching and education, from trying to organize and do courses differently from back in uni days to trying different courses and doing different things despite a particular area of interest. But also I like teaching. I like sharing knowledge. I find that just there's so much empowerment and so much benefit. You know, as a dentist, we can treat one patient at a time, right? And the concept of teaching is, you know, one element above that. You know, you can teach hopefully and inspire, you know, a group of 6 people over a year, and hopefully they will take on the values and elements, and, you know, hopefully, you know, if I'm lucky, 1 pearl of wisdom for the year, and, you know, take that on for their career, right? So then you have 6 people being able to do that. Research is like another level, and research is like treasure hunting, but you might open a treasure box after like 3 years of looking, and there may be nothing in there other than like paper that's been shredded up. Because, you know, it's just the ability to impact people. And then I think I've always had a tendency and enjoyment of surgery. So those are the factors that led me to saying, okay, well, which specialty fits? And, you know, for me, it was perio.
So I think that was a good way to round it up to as to why you picked perio. So was there any particular CPD that you didn't feel that you implemented or was not as beneficial for you at the time and you will do differently next time?
I think there's no CPD that is not going to benefit you. I think, you know, there's, like I said, there's a lot of good courses out there. There's a lot of really amazing speakers out there, and you're going to learn something. I've done a Botox course and then never done Botox in private practice. I should say injectable course. And, you know, why is that? I think sometimes those kind of treatments attract a certain patient demographic that I wasn't really interested in treating, and just didn't align, again, just with my values and my goals. And there's also practical pressures that happen. You know, if you just wanted to do, let's say, Botox for TMD or for whatever that is, you know, I think I was just conscious that I still didn't know about, okay, well, there's this concept of TMD, and there's so much to TMD beyond just, you know, injecting Botox into the muscles and providing potentially symptomatic relief. And so there was kind of that element of things, but I think any education is valuable. But the best education is the one that you can really do the next week and do on a regular basis, because, you know, in the end, we are a practical profession. And so you can do an orthodontic diploma, but if you've never put braces, or you put on braces or do aligners or whatever once a year or every 2 years, you know, you can have all the knowledge in the world, but it doesn't always translate into practice.
I hear what you're saying, and I agree with that. I think it's like, if you don't practice it at least, you know, once a week, you know, how can you possibly say that, you know, you're proficient at it? And you can have all the theory, but if you can't apply it, you know, there's not that connection that you can say, especially when it comes to whether it be mistakes or whatnot.
Yeah, absolutely.
So, has there been anyone that's been pivotal in your career, and why?
Pivotal. I've been lucky to be surrounded by good people. Kind of in foundational years, kind of at the Alfred Hospital, there was, like I said, mentioned Dr. Matthew Lim, Tommy Yap. I have to give credit to, I know he's a bit of a, there's Dr. Alexander Fibushenko. He actually probably got me into dentistry. So this was when I was 16, 17 years old. I went to observe him. Again,
for some of our viewers, how would you describe him? He's like the all-on-4.
Yeah, I mean, probably has placed, you know, up there with probably the most implants of anyone in Australia, and kind of brought all-on-4 to, I guess, mainstream dental practice and dental, you know, treatment planning options in dentistry. And people, you know, people love him, people have issues with him. That's beside the point. You know, he's an excellent clinician, and really, like I said, everyone is, you know, there's so much to learn. And so, you know, it was really funny because when people say, look, I went to observe in practice, I went to observe a dental clinic. This was honestly probably the first clinic I went to observe. And the first day I was retracting for 4 hours, watching him do an All-on-4.
This is pre-dentistry.
Yeah. I was 16 or 17 years old. So to me, like that was the first practice I saw. Little did I know, like I've probably not seen a practice like that since, not many since. So it gave me like a slightly false illusions of what dentistry is all about. But it was great, and that was that was pivotal. Other aspects have been just really beneficial, and actually another pivotal moment I'll say is meeting Dan, with whom we co-founded GDI. Like I said, I've always had that interest in education. Like I mentioned, it's again been something that's part of my value. But with him, we were able to create a program and try and deliver education in a way that we think is going to give people the most value. So that really presented kind of just a really new frame shift for me, and those were probably the most pivotal moments I can think of.
So basically, before deciding to do dentistry, you met with Dr. Alexs. He inspired you to do dentistry. You came out, and then you met Dr. Matt, was it? Matt Lim.
So Matthew Lim, and there's Dr. Tammy Yap out in the Alfred Hospital there in Melbourne area as well.
Yep, and they kind of really shaped you into the interest of the whole systemic oral health side of things, and the holistic approach to people. And then it wasn't until you met Daniel that you got really inspired that there's a branch of graduates out here that really are missing out this education that needs a bit more structure to it, and that's really how you came about a lot of it. Yeah. But
I'll add just the last element is the two practices that I worked out with Dr. Tiv and Dr. Slav. Again, you're like, understanding private practice, understanding the business aspect, understanding people who are driving and trying to create something unique or different, and that patient experience and what that patient experience can look like. It's just so fascinating. Like there's so much to get into.
Yeah. I mean, you've once actually said that Dr. Vu is a misunderstood genius, a medical doctor, a dental specialist, a library of knowledge. Is Dr. Vu still your most favorite person from the university days?
I mean, this is such a sideball question. For those that don't know, Dr. Vu was a prosthodontic clinical demonstrator and teacher at the University of Adelaide. She was in our fourth, so penultimate year with that. She was this little Vietnamese lady who spoke a million miles an hour. It was, you really had to make sure you were focused and listening. And she was like a little rocket flying between different students. And, you really had to keep up with her. She's definitely one of the most memorable people that I remember. She was great.
I think for a lot of us as well. So you've mentioned a few struggles as well, and you've talked about, how to find your first job as well. But have there been other particular struggles in your CPD or dentistry journey that, some of our viewers might not have known about?
I mean, we all have issues. CPD journey, I think, especially in your cumulative years, I think where you work is probably more important than, like I mentioned before, like whatever CPD you do. So I consider that part of the CPD journey. So, I made mistakes as well. I was, after the Alfred Hospital, I needed a break. So I went to South America for a month. But, being, I guess, very proactive and very conservative, I wanted to make sure that when I got back, I had a job, a month off, God forbid. And so with that, I kind of put pressure on myself to make sure that I did have that full-time work. And, I was part-time in a couple of practices, but one of those practices, like a lovely boss, was a great relationship, but the practice just wasn't busy enough. And so one of the things that people don't realize is, like, if you're in a practice that isn't going to help develop your, clinical skills and your profession, especially if it's a good, it's a good person, it's a good boss. You're not like having, you're not getting paid, or there's clearly some big OH&S issues or whatever it may be. But you may not, you can't really determine whether that practice is a good fit or not for maybe 6 months or more, because part of growing is understanding, okay, well, my book's maybe not full at the moment, but if I grow and, I have good recalls and patients come back and yada, yada, yada. And so, I was in this position for 6 months. That's probably when my Instagram thing started, because I had a bit more time.
Free time, yeah.
And I think I remember I was going around medical GPs and just having chats with them. And, I was being paid a retainer and everything. So, everything was reasonable in that sense. But for me, it was just, I wanted to learn. I wanted to have that hand skill and
get your hands wet.
Get your hands wet. And, one of the things I talk about to some people as well is, there is a big difference between a practice where there is a hygiene department and isn't a hygiene department, and good and bad. But one of the benefits that I saw of practices that had hygiene departments, which both practices I did, was my books were full of new patient exams and treatment. So, compared to someone who's got 8, 7, 8, 9, 10 hour day, whatever it is, where, 50% recalls and 50% is treatment. When you're focused on, that new patient relationship, you're practicing communication, right? So you're getting that practice, you're understanding treatment planning, and then you're doing treatment. So if you think about it, let's say, you have that 50% recall versus the person who's not. In 1 year, you're doing double what that other person has done from a practical standpoint. Now, there's a lot of benefit to recall. So I do emphasize that if you have a hygiene department, that you make sure you still are able to obviously review your patients and make sure you can see how your treatment has gone and follow up and all of that sort of thing. But even that, I think, has a big element on, how much you can achieve in what period of time.
Right. Yeah, so basically you just got to really look at your situation. You got to stick it out for a few months, at least. You're saying at least 6 months, to kind of really vibe, to see, if it's actually building, if the situation's changing. It's tricky in this situation, especially with COVID, it's got this stop and starts, and so you can't really tell at times. But you really got to give yourself that opportunity at that practice, or that practice, that opportunity to kind of really see if that's where you fit in. And if it's not kind of meeting what you want to aspire to be, then that's really where you got to pivot, right? Yeah.
And that's, I'm saying 6 months in cases where, things are amicable. And, if people have difficult positions or, they want to chat, like I haven't mentioned it before, but, anyone's welcome to reach out to me through Instagram or Facebook, whatever it is. Happy to help them out wherever I can.
Yeah. You've previously said the world favors the bold, those willing to be confident in themselves and resolute in their values. So to all those oddballs out there, be you, seize your opportunity. Who are you referring to, and then how would you say students make the most of their undergraduate years?
Was that our final year speech?
That was your final year speech.
Yeah. Man, that takes me back. Wow. I was going to say, did I say such rubbish? I think what I was referring to at that time was, I think, figure out what you want and, what are your values, how they co-align, and then just be persistent and persevere those goals that you have, and understand that, there are going to be hurdles out there, like obviously COVID, and for people that add challenges, and there's going to be, other life challenges. I know we talk about dentistry a lot, but there's, 50% of the other aspect of life that also has its influence on what we do and work and that relationship of things. So essentially, really the focus should be figuring it out and just going for it. I think, we regret more what we don't try and do versus, what we have done. And, that element, and things fail, you do the wrong job. You spend way too much creating an Instagram, that, was more for you than for others, and, didn't really go anywhere. And, but that's the way you learn, and that's where you grow through challenges. You definitely don't go through things being easy. And there's a saying I heard recently, hard times make hard people or hard men, and then hard men make soft times, and then soft times make soft people, and then soft people make hard times. And there's this cycle of things. And we've been in really good times. We're in a beautiful country. We're lucky. There's a lot going for us. COVID is probably one of the challenges that many people in their up to their 50s and 60s, it might be the hardest challenge they've ever had to face. And what I implore on everyone listening is don't let it stop you from persevering and pursuing what you want to try and do, because that's going to be the difference between who you were yesterday and who you will be.
Yeah. That's a good point to make. So you're studying right now, obviously, with the perio. So what would you hope your ideal clinical or non-clinical day to look like in 5 years' time?
Or what, I think I've actually thought about this, and I would say 3 days a week clinically. I think that's a sweet spot. I think just from ergonomics, your back, your neck, like dentistry is terrible. And then I think there's this element of, for me in particular, like if I'm working on 2 or 3 things, then every time I'm doing that thing, I have a new sense of energy and joy to continue persevering. So for me, I think, doing that, continuing with GDR, that's a long-term goal for me, and creating new programs and working through that. The third element of things is, not sure if 5 years, if practice ownership is on the cards at that stage, but there might be interest there, or later down the track, more interest at working with universities and research and continuing teaching in that regard.
Yeah. Well, I mean, hey, look, three days a week is fine, because as a specialist, I assume you're going to have to prepare for cases and all of that, and that really builds up. Even though you're taking day off, you're really coming back to work to really work up those cases. So it's understandable, 3 days working.
Yeah, I think for most specialists out there, 4 days is considered full time, because your 5th day is, pretty much referral writing and treatment planning and a whole lot of other things. Yeah.
Yeah. And then in your case, so what are we hoping to expect from GDR in the future?
There's a few things definitely we're working on. COVID permitting, obviously that's probably the big one, but we've got a few goals for next year. We want to continue with the residency. We've had people already message us and express interest to sign up for next year. So that's going to be hopefully launched, touch wood, this coming week or 2. So that's going to be really exciting.
Are we getting the exclusive right now? Are we getting the exclusive?
You actually probably are getting the exclusive on this. We've recently launched a photography course that has been 9 months in the making with Sabi Hunt, an amazing educator, ceramist, and we want to continue kind of broadening that. We want to expand the residency, so I won't kind of talk into too many details, but we're looking kind of expansion and providing more hands-on through that capacity. We had goals. We had a goal before lockdown, Australia's first lockdown in COVID last year, I already forget what year we were, 2020. In March, we had a goal that we wanted to be in every city between like February and November, between like Brisbane, Sydney, Melbourne, once a month. And talk about like things not working, like that got completely
hard times.
Hard times, exactly. But you know what, it created such an opportunity for us, and we thought, okay, what do we do? Well, let's create like a mini webinar series. And there's still stuff on our website and through Facebook, but that ability to create that webinar series and help people who were stuck in lockdown really probably was our ability to give much more value to people than we ever could have just flying to cities and having workshops. So what will happen, next year will obviously change, but I think that's still one of our goals. I think we want to continue helping ADSA, the Student Association, with, helping final year students and students in general. And we want to kind of, continue trying to have more impact in different states.
Well, Dr. Alexs Khominsky, there's so many more questions I want to ask you. Thank you for coming on the show today. Can you let the people know how they can reach you?
Yeah, I mean, feel free to, probably easiest is just Facebook or Instagram. Just on Facebook, I'm more about the stalker. So Alexs Minsky, Minsky, and then just Dr._Khominsky on Instagram. Like I said, anyone who's, curious about courses, curious about different aspects of different things, whatever it is, feel free to reach out. We also got a Facebook group, study club, General Dental Study Club, where we have cases, questions. Really, the group's geared towards new and recent graduates, and creating a comfortable environment where you can ask questions where you may not be so comfortable asking on other forums, and having a supportive environment where people can give you practical answers, and you feel like you're getting good information from.
So for all of our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe. For our listeners, if you like this episode, leave a review as well, and don't forget to share it with your friends, and we will see you on the next episode of CPD Junkie Podcast. Dr. Alexs Khominsky, have a good night.
See you guys.